What's up guys, welcome back to another vlog. So today I will show you how a day in my life look as a clinical rotation student doing gynecology rotation here in Chicago. So hang on, let's start the day. Let's go. Nice sunny day outside. No mails for me. Let's go. So basically this is my last week of doing my gynecology rotation, and I have already done my previous 5 weeks, and to be honest it was really fun, full of learning, full of doing all kind of work, full of seeing patients. It was a little bit of a busy rotation too, because I have to go like every day, like literally all 6 days in a week. I used to get just Sundays off and sometimes Saturdays off, but overall this was a very good and a nice rotation to do. So usually my clinic where I am doing my gynecology rotation, it's like 30 minutes away from my house, and that's the clinic where I am doing my clinical rotations. And sometimes my doctor, who is my main preceptor, takes me to the hospital where we see deliveries, hysterectomy, C-sections and all. And let's go to the clinic. And if you guys are new to my channel, don't forget to like, share and subscribe, and please press the bell icon. So let me tell you what we as a medical student have to do. This is an outpatient clinic of gynecology. So once the patient arrives, all kind of insurance and all, do the all paperwork, and once we are assigned to the patient, then we take the patient inside the room, and then we check her blood pressure. We tell the patient to give her urine sample so that we can do her urinalysis to check any kind of protein, any kind of glucose in her urine. And after that we go take her to the room and ask all kind of gynecology and obstetric questions. We have to take like a complete history so that we can come to a diagnosis if a patient is going through some kind of problem or maybe some kind of complications. So now once we start asking the question, the most important questions what we have to focus on is that when was the last menstrual period, when was the last pap smear, did they had a mammogram or not, or if the patient is obstructive patient, so we have to ask her how many weeks she is in, or if she can have if she can sense any kind of fetal movement, any loss of fluid. So we have to ask all these kinds of questions to the patient. So once we take all the history, we have to feed each and everything to inside the computer, and then we go to the doctor, the main preceptor. We present everything to him. We tell him what our care plan is, what we are going to do to the patient. Sometimes the patient come here for an annual checkup. So for an annual checkup, we usually do the blood work, cultures and all. We check for the pap smear if the patient is due for a pap smear. So it's basically said that you usually do pap smear once in a year. So then we go to the doctor, we present our case, we do a good presentation. It's very important to tell the doctor each and everything so that the doctor can get a good overview what patient is really going through. And then we also have to tell a care plan, like what will be the next step for that particular patient, and how will we treat them, what's going to be the management. We have to do all of this thing, and then the doctor comes with us inside the room, and then he talks to the patient. And once he talks to the patient, once he is done with everything, then he goes and put the care plan, put the treatment, and that's all. That's how I do for my patients. The most important thing you have to keep in the mind is that you have to take a thorough history of everything, like literally a thorough history. When was her last menstrual period, when was her last pap smear, if she is having any kind of BOIDS, that's a mnemonic for burning, odor, itching, discharge and spotting, if she is having any kind of these things. Actually what we as a medical students do, that's what our job is to do. So hang on and let's go to the clinic then. That's my clinic, and now I will go and park my car. Let's go to the parking and let's park it here. So I always keep my white coat here in the car. So now let's head towards the clinic. Let's start this day with a wonderful note and let's see some patients today. So now let me give you a small tour of my clinic. So this is how the room in this clinic looks like. So we have the bed where the patient come and sit if she has to go through any examination, and then we have all kind of equipment just in case the doctor needs anything, and that's the speculum through which we do the cultures and the pap smear. And then we have okay, so this is the fundal tape through which we check the distance between the pelvic bone and the top of the uterus. This basically helps us to determine if the baby is small for its gestational age, so it's very important. Then we have the computer in which we do the notes. So here we have a lidocaine. For example, if a patient has to go through any procedure, or if a patient has to go through any stitch removal, then we have a stitch removal kit. Then we have all kind of equipment for drawing blood. These are the test tubes in which the blood are drawn and sent to the lab for evaluation. So this is the student area where we come and relax when we don't have a patient to see. So just got assigned with my first patient. So let's go and see the patient. So this is how my template looks like when I go and ask questions from the patient. So I have the vitals on the top, then I ask for the urine, then comes the chief complaint, past medical history, family history, and the BOIDS, then the gestational age, last menstrual period. If she's an obstetric patient, then estimated date of delivery, and that's all. And then we feed everything in the computer. So let's take the blood pressure of the patient and her weight and height and check her BMI. So after taking the vital, now I am going to check her urine. So the first step is we check her for the pregnancy. So we take the pregnancy kit and dip it into the urine and then let it be there for like a couple of seconds, and then we check if she is pregnant or not. And then we take the dipstick and check her for any abnormalities or any problems in her urine. So the reason why we check her urine to know that if she is having any kind of UTIs, any bacterial infections, any kidney stone, any liver disease, and any STDs such as gonorrhea or any other abnormalities. Okay, so now it's time for the results. So for the results we have to write everything down. So for this patient, the leukocytes are negative, the nitrites are negative, the urobilinogen is a little bit positive, you can say. Then comes the protein is negative, the pH is 7, blood is negative, the specific gravity is 1.030. Then comes the ketone is negative, bilirubin is negative, and glucose is somewhere a little bit of, yeah, glucose is negative. So then we write it down everything, and then we have to feed all of these things to the computer. So let's go and do that. So that's how the results look like. So after seeing my first patient and taking a thorough history and presenting it to the doctor, we have come to a conclusion that we'll do the cultures and blood work to see if she is going through any kind of bacterial problems or any kind of yeast infection. So let's go and do the cultures now. So these are all the cultures what we are going to do on this patient right now, and this one is to check if she's having any bacterial vaginosis or not. And then we also have to do the pap smear today because she haven't had a pap smear since past 2 years. So this is for the pap smear, and that's all. Let's go and do the cultures. So after cultures and everything, it's time to do the notes. So let's go and do the notes. So that's how my note looked like, a 30-year-old with her Gravida and Para, and that's all the medication what we prescribed her, and this is her review system, her objectives, and then here we comes to the care plan, what we decided for her today and what we are going to do in her next visit. There you go. So this is the urine culture what she had her last time. So finally done seeing two of my patients. One was an OB patient, another one had some fibroids in the uterus. So those were like they were fine. So now done with my two patients. I have two more patients to see right now, and then after that I will be done. I am already so tired right now, but let's go and see two more patients. So you know the best part of doing OB-GYN here at this clinic is that you get good food to eat every week.
Yes, sir.
How's the food, guys? That's why we love OB-GYN here, right? Right, Derek?
I'm still thinking about it.
So finally done seeing all my patients. Unfortunately, I got assigned to one of a new patients here, and new patients usually take around an hour. You have to ask each and every question from them, and then you have to go and present. You have to do a detailed presentation for new patients because they are new into the clinic, and then you have to ask all the previous histories, all the previous visits, where they visited previously, which surgeries they had, if they had any surgeries, which doctor did the surgery, which hospital they went to have that surgery. So that was a tiring presentation. So yeah, finally done with all my 4 patients, and now I am ready to go, ready to leave and go back home. So finally done for the day today, and now I am heading towards home. It's already 6 and I am literally very tired. So if you guys like my video, do like, share and subscribe, and don't forget to hit the bell icon. Thank you so much. Thank you for watching my video. See you guys until next time.